Potty talk, that's what we're doing today. It's usually kept quiet and private. I mean, real potty talk. But today, we are making urine business our business. Get it? Urine business, our business. Have you ever had those moments where maybe you sneeze or laugh a little too hard? It's actually a lot more common problem among adults. And joining us today is Dr. Cathy Naughton. She's a urologist with St. Luke's Hospital, and we're so glad you're here today.
Thank you, Ken.
We're going to make this a fun and productive talk.
Sure.
Because it is a delicate conversation that a lot of people really don't want to have. We can talk about that part of it a little bit too. But if you have little leaks, little urine leaks, is that common with aging, first of all?
The short answer is no.
Oh.
So leaking is not a normal part of aging. The problem is our society has normalized this by having pads and, you know, in every convenience
Seeing all the
store.
commercials.
Absolutely,
Yeah.
but it is not a normal part of aging, and it can be an indication for other serious medical problems. So if you do have urinary leakage, you should seek medical attention.
At least mention it to your doctor,
Absolutely.
and they can tell you if it's this is not a problem.
Right.
This is because of this. And there are a couple of reasons we might have that. One is overactive bladder, what they call OAB.
Correct. So I'm glad you mentioned the leaking with coughing and sneezing, because that is quite different from overactive bladder. Now, a lot of patients can have both types of leakage. However, overactive bladder is a condition described as urgency, frequency, getting up at night, and this can be with or without leakage. So a lot of patients suffer in silence, avoiding things they really enjoy doing. Going out to dinner, going to movies, even going on vacation because they're worried about not having a bathroom available.
Huge self-conscious
Right.
issue.
Overactive bladder is very common. So 1 in 6 adults have overactive bladder, both men and women.
And how do you evaluate that?
So the evaluation begins with a thorough history and physical. I often do some urine tests, and then I often recommend something called cystoscopy. This is a procedure that's done in the office where I place a little lighted telescope with water running through it into the bladder itself so I can visualize the lining of the bladder. That's very important to do because a lot of x-rays cannot diagnose things that I can see in the bladder.
And I would think, I'm just speaking from personal view, that a lot of people are uncomfortable not only talking about this, but talking about any kind of a treatment plan other than a medication.
Right. So the American Urologic Association actually has put out published guidelines for treatment, and this starts with the first tier, which begins with behavior modification, physical therapy or pelvic physical therapy, and or medication. So there are common bladder stimulants that you can avoid to try to decrease symptoms, such as caffeine in coffee, tea, soda, chocolate. Physical therapy is designed so that you learn the muscles of the pelvic floor so you can do anything you want with them. You can contract them if you want to avoid leakage, or you can relax them, which is very important when you want to void to completion.
And a change in the or addition of therapy and a change in diet can combine to really avoid any other kinds of procedures.
I'm a big fan of least invasive to most invasive, so even medication can have side effects. And in fact, 70% of patients will stop medications after 6 months for one of many reasons: side effects, cost, compliance, or it just doesn't work. So I want to touch a little bit on these advanced therapies besides those treatments.
We're going to do that. I think we'll have time to do that in our Excel after the show.
Because there are advanced therapies.
Yes, and there's a lot of new things going on out there that you need to know about. Dr. Cathy Naughton will share with us some of those things. And if you'd like more information, we have all the details on your screen right there. You can visit stlukes.com and search for Dr. Cathy Naughton, or you can call 636-685-7830. And you can also find her on Instagram at The Vegan Urologist. The Vegan Urologist on Instagram. And we're going to discuss this more. I don't want to say we're going to dig down. That makes me uncomfortable when I say that. But we are going to talk more about it. And maybe take some of your questions today on today's Great Day Extra Live. And GDXO will kick off on Great Day's Facebook page at about 10:15 this morning. And we hope you can join us and chime in. GDXL is brought to you by the Bomarito Automotive Group. A lot of people, you know, they talk about suffer in silence, and a lot of people do, unfortunately, and you don't have to do that. And there are treatment plans that are non-evasive that we can talk about that. And if you have any questions, you can call them in.
And thank goodness there are so many options.
Yeah.
Indeed.
Yeah. Thank you very much, you two.